Remaining sets or the remaining hygiene procedures before we end and conclude our hygiene procedure demonstration. So today I'll have to demonstrate your set 2, which is your bed bath and back care. First, I have to start with your bed bathing. As I have written on the board, these are the different parts of the body that you have to clean and wash. So starting from the head, then for the head, which is the face, and then we will end with the back. So let's proceed to your bed bathing. So start with your opening. So once you have the procedure, once you have the record, you already have the idea on what procedure you have to do. So if there's any instruction or any, for example, policy of the hospital or the facility that bed bathing is done every day, every other day, depends on the policy of the facility. So once you have the information or you have the record, then you go directly to your hand washing and gather all the supply from your supply room and then take it with you, go directly to your patient's room. You not go directly to the side table, put all your equipment to the side, then you start talking to your patient. If it's a new patient, then you identify, introduce, and explain the procedure. Assume patient is aware of the procedure that you are assisting him to take a bath, okay, while they are lying on their bed. Then, before starting that, because this is somewhat observe strict privacy, okay, or you need to provide privacy because you are cleaning body parts, okay. So first is you need to close the curtain and then put your gloves. So while you are putting your gloves, making sure you are also providing safety to your patient by putting the wheels locked and the side wheels up, but keep the side wheels up on the other side opposite to you and make the wheels, the side wheels on the side nearest to you down for your accessibility. So then you can also build rapport while also preparing your procedure, okay. Then this time you have to grab a bath blanket, okay. So you have an extra blanket. This bath blanket will be spread on top of the patient. This will cover the patient because once this will get wet, okay, in the entire procedure, this will go directly to the laundry, okay. So what you have to do, spread this one first on top. So once you spread, you have to ask the patient to hold the edge of the blanket or the bath blanket. Ma'am. Okay, so please hold the edge, ma'am. Okay, because you are, or I am about to, remove from behind the patient's blanket. Okay, because this one I have to fold this because this is new. Okay, it's still clean, so I just have to fold it, and then I'll be using this bath later. Once I have to remove this bath blanket, because again, this one will go directly to the laundry. This one will be put it back. Okay? So I'll put it down on the side. Then once the patient is covered with the bath blanket, then I'm now ready to take a bath my patient. So before washing, I'll have to assist the patient to remove the gown or the clothes that he or she is wearing. Okay? So if she can do it by herself, then you just have to let her do it. But if not, then assist her. So untie the gown or assist her. So make sure that the patient is naked inside and covered with this bath blanket. Okay? So let's assume that Ma'am Roger is naked. Okay? Then you're now ready to start with the bathing. So you start with the face. Okay? So what equipment that you need to use, make sure that you have your two basins and 2 washcloths. Okay, so these two washcloths will have a separate, use. This first basin and washcloth, this is soaked in a soapy water, okay, and then the other one is a clear water for rinsing, okay. And because we are starting with the face, and most of the face, the part of the face is sensitive, so avoid using soap. Okay, for the face, only use clear water in washing the face. You get me? Avoid soap. So before washing the face now, you grab your bath towel. Okay? Spread it across the patient's chest. Always before washing, okay, or when you are using, on all procedures that you are using water, make sure before touching the patient or washing the patient's skin, make sure that you ask the patient the temperature of the water. Okay? Ma'am, can you check for me please your temperature of the water? Is it fine with you or okay with you? Okay, if she's okay with it, then you can proceed. Okay? So this time, the face. Okay? So using the clear water, you just have to do your cloth mitten. You wrap your washcloth into the palm, and then you just have to insert it to mitten. Okay? So this time you just have to wet, and then you start with the eyes. Okay? Start with the eyes, one eye at a time. Okay? So you start with a part of the eye which is near, or the side of the eye which is nearest to you, and use one part or side of the washcloth at a time to avoid contamination or cross-contamination. If you use this one side or one part of this cloth, then you just have to start by wiping from the inner to outer canthus of the eye using one side of the washcloth, and then once you go to the other side of the eye, use another side of the washcloth. Okay? Then do it like this. Okay? Avoid cross-contamination. Okay? So after the eyes, then you wash. You go to the inner ear, outer ear, inner ear, outer ear. Then you wash. Then you go to the face. Okay? Then you wash. Then you go to the neck. Then you wash. Okay? So it's common sense that once you see that the water is no longer clean, then you just have to change, okay, from time to time, and then ask the temperature. Okay? Then after the face, then you just have to use this towel, okay, to pat dry the face. You get it? Then after the face, which part is next? Okay, the arms and the hands. Okay? So consideration, once you are exposing, okay, the body parts, make sure that you have to expose the body parts one at a time and keep the other part closed, because again, patient is naked. Okay? So you're doing your arms and hands washing, then you have to expose one arm. Start with the arm and hands which is nearest to you and cover it, expose it, while you are covering the other arms. Okay? So you expose, then you place the towel underneath the arms for absorption. Okay? So this time, you can now start by the soapy water, washing with soapy water. So the same technique, do your cloth mitten. This is with soap. Okay? Wash, you start from the shoulder down to the wrist, long downward stroke, shoulder to the wrist, not, okay? Shoulder to the wrist, and you lift your arm, armpit, kilikili to the wrist. Okay? Then you can now soak, okay? While you are washing the hands, you can also soak, but make sure that there is no contraindication in soaking. So if the patient is having no diabetes or any problem with the nerve and circulation, then you can soak. But if it's contraindicated, then avoid soaking. You just have to wipe and wash. Okay? But if there's no contraindication, soak while you are washing the hands. This is with soap and water. Make sure when you wash, you concentrate on the in-between areas of the fingers. You got it? So thoroughly wash it. Then after washing with soap and water, you grab your basin with the clear water for rinsing. Doing the same steps. Rinse with clear water, shoulder to the wrist, okay, lift, armpit to the wrist. Then you soak, then you rinse the hands if there's no contraindications, okay? Then you're done with washing and rinsing, then you pat dry, okay? After patting dry, then you cover back with the back blanket, and then make sure during your demonstration, you just have to mention it that you're doing the other side, okay, to cut the time, okay? But in reality, do both sides, okay? Again, I'm getting it. Once you do your demonstration, you just have to mention it. You get it? So for me, I'm done with one side. I have to mention that I'm going to the other side, sir. Then I'm doing the same steps. Okay? So I get it. So both arms and hands are done. Wash and rinse. Then I'll go to the next part of the body, which is the chest and then the abdomen. This time, you grab again your black towel, put it across the patient's chest. Okay? So then you slowly pull down the back blanket from behind up to the waist level to expose for you to easily access the chest and the abdomen of the patient. Consideration, check the gender of your patient. If the patient is male, then you need to make sure that you are observing the correct stroke in washing. First, again, using your soap and water, take your basin, okay? So you can use also your side table so that it will be easy for you to use it, okay? So make sure you have your side table, and then this is with the soap and water. If the patient is male, you just have to wash from inside, okay? Do the long downward stroke from chest to the abdomen, because males, they don't have a prominent breast, okay? You can go directly downward, okay? Wash with soap and water, downward, 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 okay? From chest to the abdomen, male patient. And what if the patient is female, okay? So you just have to start with the breast. You have your prominent breast, girls, right? So you just have to do your inner to outer breast, one breast, and then you go to the other breast, inner to outer breast, okay, in a circular motion. Then you wash, then you go to the downward stroke, going to the abdomen, okay? Then that's your stroke, using your soap and water. Then you rinse with clear water. Grab your soap, grab your basin with clear water, do your mitten, then you rinse, okay? Long downward stroke for male, and then wash, or you do your circular, one breast at a time, then you go your downward, going to your abdomen if the patient is female, okay? Then you wash and you rinse. You use this towel to pat dry. After patting dry, you can cover back, okay, the back blanket, and you remove the towel from behind, okay, keeping the patient's privacy, okay. Then you're done with your chest and abdomen. Where are you going? Going home? Going to the legs and feet, okay. So legs and feet, just the same with the arms and hands. You are exposing one leg at a time, okay, maintaining the privacy. So expose one leg, okay. Then make sure the other leg is still covered, okay? Then take the towel, put it underneath the patient's leg, okay? Then start with washing with the soap and water. Do your mitten. And this time, you start from the perineal area, okay? Which is this area, the singit area. Okay, going down to the ankle, okay? Say one long stroke, okay? And then you lift, the buttocks, the puwet, down to the ankle, okay? Using the soap and water. Then, after that, again, from time to time, it's not clean, change the water, okay? Then you have to go directly to the feet. Soak it if it's not contraindicated. Avoid soaking if it's contraindicated. You know that because you will have the access to the patient's chart. Then just do it. If it's contraindicated, stop. If not, do it. Okay? Then Same thing with the hands. You just have to wash, okay? Especially the in-between areas of the toes, okay? Then after soaking, and then you just have to grab your clear water, okay? You do the rinsing. Same stroke from the perineal to the ankle, then lift, buttocks to the ankle, then you rinse the foot, okay? If it's not contraindicated, proceed. Then make sure you rinse also the in-between areas of the toes, okay? After washing and rinsing, then you have to do your pat drying using the towel that you place underneath, okay? Then pat dry, then cover back the leg which is on your side, and you go to the other side of the leg, do the same steps. In reality, do it. In your demonstration, mention it. Both legs and feet are done, okay? Washing and cleaning, rinsing, then you go directly to the last part of the bed bathing, which is the back, okay? This time, the patient is conscious, they can be able to turn themselves, okay, to the other side, which is opposite to you. If they cannot do that, then just grab or ask somebody to help you to roll the patient. Your colleague or your support will just hold the patient. If the patient cannot do it by themselves, especially the patient is unconscious or so big, so you just ask Akin, please hold the patient for me while you are washing the back, okay? But Roger seems, or Madam seems conscious and able, then you just have to inform, okay? And would you mind to roll to the other side, please? Because I have to wash your back, okay? Then, this time, expose only the back part, okay? Expose, and then grab your towel, put it underneath, okay? Under to absorb, okay? All liquids or water from the patient's back. Same steps, start with your soapy water, grab your washcloth, then you start from the neck to the waist, downward stroke, neck to the waist, neck to the waist, neck to the waist. This is with soap and water, then you rinse with your clear water, do your mitten, and then you do the same stroke, neck to the waist, rinse, neck to the waist, rinse, 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 remove the soap, and then after that, you're done with the washing and rinsing. Take this towel, pat dry the back, okay? And then you just have to cover back the patient, then you position. But because in reality, bed bathing is done separately from back massage, because mostly as per the protocol of the facility, it is being done in the morning. They're doing bed bathing in the morning, and they're doing the back massage or back care in the evening. But because we're doing the training and the demonstration, we just have it go together so that it will shorten again the time. So during your demonstration, after you have cleaned and washed the back, keep the patient in the sideline position, then you offer the back massage, okay? So for the back massage, you just have to make sure you need to mention the patient, you need to inform the patient. Ma'am, I'm done doing your back, okay, bed bathing. Now I'm done, I'm doing your back massage, okay? I just have to help you do some massage, okay? So this time I just have to ask you what solution or what you want to use. Either you want to use lotion or oil. You have your preference?
Oil.
Okay, so you have to grab your oil from your supply. If they have their own, then if they can, sometimes they I have my own. Okay, no worries. Use that, or if not, take it from the supply. Okay, take an oil. Okay, take an oil and put it into your palm, and then rub it to your palm, and then do your 4 types of massage. The first type of massage is effleurage. How will you do that? For effleurage, you do a long gliding stroke as if that you're doing your swimming. From down to up, long gliding stroke, like. Okay, that's your long gliding stroke, that's your effleurage. Second type of massage is your petrissage. Petrissage is that you're just running fingers. It's like you run, you slide your fingers from down to up. Okay? That's your petrissage. The third one is tapotement, from the word tap. So you're just tapping. Okay? That's for your tapotement. You're just tapping the back of your patient. And then the last one is from the word deep friction. You are putting pressure. Okay? Using your thumb or using your fingers. Maybe in ng konti. Right? Okay? Then you can just do it repeatedly, all the 4 types of massage in the span of 6 to 10 minutes maximum. Okay? Don't do it within an hour kasi iba na yun. Papunta na tayo sa spa. Okay? Pag ganun, baka happy ending ng nangyari. Wala namang ganun. Okay? Because you are doing this back massage for what? Relaxation and also to promote proper blood circulation for your patient. Yun lang aim natin. Kaya 10 minutes is over. Okay? We're good? Then this time, you're done with your set 2. So, you do your closing. You just have to, okay? Then after this, make sure that you grab your towel. Then if there's an excess, I missed. Make sure this towel is also on the side, on the back or the underneath the patient's back, so that once there will be excess oil, it will just absorb. And then use this one to pat dry the excess or remove the excess oil used or lotion. Okay? And after this, you do your closing. Okay? Okay, cover. Ma'am, would you mind to go back? We're done with the massage. Then, do your closing. How will you close? Before positioning your patient, take that patient's towel. Put back. Okay? The patient's blanket. Then ask your patient, ma'am, can you hold the edge please? Because I have to remove the patient's blanket from your hand. Okay? Then this one, you just have to put it onto your laundry basket. Okay? Then before you do your closing, you can assist your patient to change, put back the clothes. Okay? Because you're done. Okay? And after putting back the clothes, then you are now ready to do your closing. Patient's comfortability, position the patient. If they want to be elevated, if they want to flat on bed, adjust the head, adjust the bed. Then safety, rails up, wheels locked. Okay. Then for security, offer call light or call bell. Okay, for emergency. Then to maintain the privacy, make sure the patient is still covered, and then open the curtain. You cover the patient first before you open the curtain. Then say goodbye to your patient. Okay, and then you take all the equipments with you, return to the supply room, okay? Go to your station, you do your hand wash, remove your gloves, do your hand washing, and do your documentation. Okay? Take note, there are three considerations, there are 3 things that you need to remember, always remember and consider while you're doing your bed bathing. You need always to provide privacy, safety, and security. Okay? All throughout the bed bathing, you need to provide privacy, safety, and security. We're good? We're done with our set 2. Okay? So sa set 2, start with your opening, do your bed bathing, go directly to your back massage, then do your closing. Okay? So para mabilis. We're good? Then let's proceed to your set 3. You can